Welcome to the Power Lunch on LinkedIn Live. I'm Rhett Power, your host. We do this program Monday through Friday around 12 noon Eastern Standard Time on LinkedIn's new live platform. What the point of the show is to talk to today's thought leaders, best-selling authors, CEOs, people who are doing amazing work in the world that can make us better at what we do. And that's the whole point of the show. The show is interactive, and if we don't get to your questions on the program, on LinkedIn, or on the other platforms that we broadcast on, we will certainly answer your questions after the program on those platforms. So please do ask them. We want you to get your questions out to our guests, again, so that you can learn and get better at what you need to get better at. Now, the fun part about this program is when it's live, we are on LinkedIn, we are on Facebook, we are on Twitter, we are on YouTube, Twitch, and I think one or two others. So we are across all these live platforms, and that's really exciting. If you like the program, give it a like or share so that your network can benefit from these conversations, and of course, so we can grow. We also want to do that. Now, today, I've got Dr. Anuj Shah. He has been named one of the top physicians, top doctors in New Jersey and in the world, actually. He holds 7 board certifications, including internal medicine, cardiology, interventional cardiology. I want to understand what that means. That's a new term I've never heard. He's a founder and director of the Apex Heart and Vascular Care Center. He has privileges at Hackensack University Medical Center, St. Mary's Medical Center, St. Michael's Medical Center. I think he did his training at Mount Sinai. And I want to thank Kristen Ruby for introducing us, Dr. Shah, but thank you for being on the program.
Thank you so much, Rhett. Absolute pleasure to be here. Yeah, I mean, interventional cardiology and cardiology, that's right. You know, you can just summarize by saying we are in the business of healing hearts.
I love it. Probably both ways, right?
That's right.
They can be broken in lots of ways, I understand. Never happened to me, but anyway. So you're really interesting because we're going to talk a lot about entrepreneurship today because you're an entrepreneur and you've started this center, and I think that's really fascinating because you understand the stress and the burnout and the challenge of starting a business, and at the same time you're dealing with the stress of helping try to fix people, get them in, of course, to better health. You're kind of on that kind of mission, right, to make people's heart health better. Can you talk about that?
Yes, absolutely. And you're right. I mean, I am wearing multiple hats because I'm a heart doctor, I'm a heart surgeon, like I do interventional cardiology for stents, unclog those arteries, heal those broken hearts, as I said. But I'm also an entrepreneur. I'm a business owner. I have Apex Heart and Vascular, which is the heart and vascular aspect of our practice. And I have a vein restoration clinic, which is for circulation. So I wear multiple hats. I also work as an advisor to a digital health therapeutic company, and multiple other speaking engagement and not. So I truly wear a lot of different hats. So I truly resonate with most entrepreneurs out there. And it's funny, we get I get a lot of entrepreneurs who come to the office, and they tell me about their lives, how busy they are, and how they don't have time or time to sleep, time to exercise, all the right things. And, how they're having all the symptoms and signs. And while I'm talking to them and doing this consultation, I'm thinking in my mind, this is the story of my own life here. So, it's something that I truly connect and resonate very well with. But yeah, heart disease is obviously, as we all know, it's one of the leading cause of mortality even in 2019, even in 2020, 1 in 3 Americans will suffer from some form of cardiovascular disease and probably end up dying from it. I always say that more people die of cardiovascular disease than combined top 5 cancers. And then you can add on top of that all the natural disasters and terrorist attacks and gun-related violence and road
car accidents,
all the top leading cause of mortality you combine, top 5 cancers, you mix all that, and then you put heart disease, there's still more of cardiovascular disease. And unlike the traditional belief that, it's an old age thing, oftentimes it's not. very preventable. So that's why it's surprising that the science has advanced so much, our knowledge and understanding, the preventive modalities have advanced so much, and yet we can't tame this beast. You know, the number one enemy of humanity is still pretty strong.
And we know what will prevent it. We just don't do it.
That's right, and that's what I said, that most people know what needs to be done. It's just we don't know how to do that. In other words, we know what are the healthy habits. We just don't know the science of habit formation. And that's why there is one class of people, if I strongly believe will benefit, is people who are entrepreneurs. I think people who are willing to learn, people who love learning new skills. I think they have the highest probability of learning how to form healthy habits and then and stick to that.
Right. So is there something different? So I'm not 50 yet. I'm maybe a year away or so. I don't have a birthday coming up for another couple months. What is the difference between somebody that's 20 and somebody that's 50? And sort of, is there something that you should be doing at 20 and something you should be doing at 30, something at 40, because I know as we age, we have different risk factors and different things that can really, we need to pay attention to. What are those?
Yeah, so I think heart disease is a spectrum, right? It's everyone's in that spectrum. It's not just the sickness, it's the wellness as well. So within this spectrum, no matter where you are, first of all, anyone and everyone will benefit from healthier habits. Everyone will benefit from exercising regularly. Everyone will benefit from proper diet and proper sleep hygiene. Practicing meditation, gratitude. All that stuff will truly help no matter what age group you are. The advantage if you are young is you can sort of get away. Okay, your body has great compensatory mechanism built in, so you can push, and the rubber won't break. Up until a point. So unfortunately or fortunately, if you are younger, you can sort of get away. But what's happening when you are getting away is you are creating the substrate, which will eventually lead to more catastrophic situations down the road. In other words, the commonest heart problem being coronary artery disease, which is blockage formation in the body, in the heart arteries and other blood vessels. And what will unfortunately end up happening is when people don't live a healthier lifestyle, when they don't have the healthy habits, they will start getting this early changes, what we call atherosclerosis, which is plaque building formation. And up until a point, it will not bother them with symptoms. Up until a point, it may not lead to heart attack or stroke or anything catastrophic. And then at one point, and usually, unfortunately, it happens. It used to happen in 50s. Now we see even younger. We used to see like people in their 40s getting like, I'm sure everybody has heard of someone who in their 40s ended up having a heart attack or a stroke. We are actually seeing this in 30s. I actually recently had a person who was 28-year-old walk in, works in Wall Street, very busy executive, has no time, investment banker, and had a massive heart attack. So the whole pendulum is shifting. The disease process is happening much earlier, because if you think about it, this 28-year-old probably is living the lifestyle and has packed in number of hours of work that's almost like another person in 50 years would have. So no matter where you are in the age spectrum, there is something that can be done. How to tailor the therapy, that's the key, because, again, not we need to do blanket. The fitness regimen can be tailored for individuals. So in the earlier years, no matter what age you are, cardiovascular exercise is the most essential, right? Which is allowing your heart rate to go to a certain pace for like good 15 to 20 minutes. That's the end of the day key for as far as the heart itself is concerned, for the proper cardiovascular exercise, let's say. So the formula we use is 220 minus your age. That's your maximum heart rate you should be getting. So if you are 50, your max is 170. If you are 30, your max is 190, right? And then you should be trying to get at least 70 to 80% of that maximal heart rate. So if you are 45 or almost 50, your heart rate should be around 140, 150, and you should try to achieve exercise at least. This is the least form of exercise I'm talking about, which allow your heart to go to a heart rate of like 140 to 150 for a good 15, 20 minutes, and at least 4 days a week. That's the least. Anything more you do, it's fantastic and it's great. And we know that, the no exercise versus even this much exercise, the benefit is super high. But then every increment in exercise and fitness will continue to bring benefit as far as, your cardiovascular outcomes are concerned. So as far as when you are 20 versus 40, that's where it becomes very important. The other thing that becomes very important is rest of your body, right? The muscular exercise. So when people get into their 40s and 50s, it's more time to focus on that cardio portion of the exercise rather than the muscle building phase of the exercise. Same way, diet is as I said, is very, very, very essential, and you will get away if you are younger with eating unhealthy diet. It's gonna act up. Same thing with substrates, right? I mean, substance.
Right.
We all know, right? Drinking, alcohol addiction, all those things. To a point, one can get away. But I think it's always good to start thinking early on. And as I said, it's very difficult to form habits as time goes on. It almost always is much easier to form habits when you're younger. So, I would urge that no matter what age a person is, start forming healthier habits and see a fitness instructor, because they can truly tailor the exercise regimen based on the exercise goals, whether it's cardiovascular, whether it's muscle building, whether it's weight loss, and tailor the exercise regimen. Same way the diet regimen can be also tailored to an individual.
Do you believe in the sort of seeing, I was just at a conference a couple of weeks ago that I thought was really fascinating, and there was a talk about sort of integrative medicine where you have someone that helps you sort of pull together all of your medical care and look at what kind of diet is appropriate for you, what kind of food you should be eating, because it's not kind of a one size fits all. Not everybody needs to be on the keto diet or this diet or that diet, right? You need to understand your body more. You understand what you need, I guess.
Right, absolutely. I think the diet is one of those things where, it keeps changing, right? I mean, what we thought was really cool and like perfect 20 years ago, we cringe at that. Right? People used to think, oh, like no carb diet, and then like no fat diet, and then no sugar diet came, and then keto diet became hot. So it's very difficult because what we gotta look at is not short term. A lot of things in short term immediately gives tremendous, beautiful, great results, right? Especially weight loss diets. People go on Atkins, people go join Weight Watchers, and again, these things are fantastic. Keto diet, for example. But what I would tell my patients at least, and people and my friends, and people who ask my advice is really focus on what's gonna build a healthy habit, because you can go 0 to 60, 0 to 100 very quickly, lose a lot of weight, and I've seen so many folks that they unfortunately gain that weight back. Same way, like people go on this health sprint, but health is not a sprint; it's a marathon. So you got to look at something that brings great long-term results. And this is where science is still struggling to find out what's one of the most perfect, greatest diets, and what is it something that people can stick with it, right? And that requires motivation, but that also requires your palate has to be trained and all that. So integration of a lot of disciplines has to happen. We know that Mediterranean diet, for example, is known to have the best cardiovascular outcomes. That's the only diet that is what we call a randomized controlled data supporting that it actually helps with this. Everything else has benefit in terms of weight loss. We know on animal models that the plant-based diet, for example, has great results. It causes less atherosclerosis. So a lot of people do, recommend vegan diet because of that. Lately, there have been a little bit controversy even around it. They looked at in United Kingdom, then there was marginally higher incidence of stroke in people who are vegetarian and vegan, which created a big uproar. And turned out people said, oh, but then you got to look at those results and those statistics and studies, and it turned out it's what we call association and not a causation. It's just like one of those random statistical outliers that came out. Still, as far as the cardiac health is concerned, that diet was better. So that's why diet is one of those things that continues to change. We all know that everything in moderation is great. So, absolutely like avoid, heavy, fatty, especially the saturated fat, that has to be avoided. Excess of carbs and excess of sugar is bad for everyone. Like those sort of things, everyone knows. So common sense plays a role as well. And as I said, diet itself is not diet. Diet is a lot of things. Diet is your culture. Right?
Right.
What culture? I mean, culturally, you are raised in a particular way. So if we do want to make a change in people's diet and the population like health, if you think about it, first we got to act and change the cultural beliefs, and we got to change the way people are raised and families are raised and what the family values are. I don't even want to comment on the food industry, but industry has to. I mean, so the government and regulation agencies have to come and make a change because healthier food traditionally is more expensive. So
Right.
again, fundamental shift has to come in until the food becomes cheaper. The healthier food, the salad's not costing you $15. You can't change that. So what you got to do is change your mentality and say, you know what? I am committed to my health. Even if it means I'm going to have $15 for lunch every day, that's okay. And that requires a mentality shift. So that's where the integration comes in, is your belief systems have to change. You have to almost be committed to being healthy. For lack of better words, you will be a little bit obsessive that, you know what, no matter what I do, because the minute you like let go of that, things start falling, So yeah, integration is the key, the habits, exercise, paying attention. What do you actually believe in? What are your values? Do you believe in vegan diet or not, plant-based diet or not? But again, something that is long, that can give you long benefit is what I would strongly recommend.
It's something that you can follow, right? I mean, if I like my occasional, filet, I can't eat it every night. But if I decide once a month I'm going to have a filet, that's probably okay.
Cheat day, yeah. And it depends on one's definition of okay, right? Once a month, absolutely, But this is where some people will push that envelope, obviously. Actually,
Right.
filet itself is not bad. It's the side dishes, right, that go with it. The potatoes and then the extra butter that go on
if I decide I'm going to have broccoli instead of that nice potato and yeah. I mean, I think
exactly.
I think it seems to me like
moderation
is
in moderation and well balanced. And again, if somebody is disciplined enough, they have that one cheat day and it like kind of fuels them to be like ready, for rest of the month. Absolutely. I mean, I have a lot of patients who are open heart surgery. They come to me for follow up and they love seeing me because I actually write them. I actually take like old school prescription, and on that prescription pad, I write down like cheat day number 1 in like 30 days, and they love it. Like you're allowed to have a cheat day once a month, and I give them a prescription of that. I also give a prescription of smiles and hugs, and they just love it.
I think it's also it's like cutting out the stuff that is really bad, that you don't need, right? You have to get into that habit of discipline of saying, okay, I might have a cheat day, but even if I have a cheat day, it's not going to be, I'm not going to sit down and eat a whole pizza. I'm not going to sit down
Right. If you have hypertension, your blood pressure is running high, your cheat day cannot be like something super salty, like a crazy Chinese food,
right.
Then your pressure is going to go up. If your pressure goes up, like even for like 1 hour, about 200, you can get a stroke. So you all, cheat day also has to be in moderation. Absolutely.
Right. I think you have to be smart about, you do have to make some lifestyle changes. I think that's just are there questions? So at 40 or 30, are there questions I need or tests that I need that I should actually ask for and sort of push?
Yes. So absolutely. So this is where the early marker of disease is something that we should look for, right? So there is really no blanket answer to this. And I think everyone should tailor their own cardiac workup. In other words, what is an individual's risk? And it really factors into, do they have any other risk factors? Do they have excess weight? Do they have high blood pressure, cholesterol, diabetes? Do they have family history? Family history happens to be one of those major causes of cardiovascular mortality. People who have, father, mother, like, anybody, uncle, aunt, there's almost 20% chance of them getting trouble. Now, I always say that DNA runs in the family, so does recipes run in the family, okay? So people pass, like parents pass the DNA from father to the kid, and they pass the recipes. So, people who have traditionally unhealthy diet in the families, that continues in the diet. So you have to tease it out. And we used to believe, we always used to say that, smoking, diabetes, hypertension, high cholesterol, and family history. Those are the 5 big ones. Out of these 5, 4 are something you can change. 5th is family history. You cannot change it. And I always tell people now that that's not true. Family history is something you could change by, not doing things that your family members did that led to this thing. So, but really it comes down to what one's individual risk. Based on this risk, if you have a family history, then, there are certain tests that absolutely should be done to make sure you are not developing the markers of atherosclerosis, which is blockage formation process, right? So what are some of those markers that we need to do? So everyone should get an EKG, an electrocardiogram, to make sure there's no overt abnormality of their heart rhythm. There is no major problem that just literally comes across. We gotta check cholesterol, make sure cholesterol is not very high. There is no such thing as high or low cholesterol. Within cholesterol, there is good cholesterol and certain type of bad cholesterol. The one type of bad cholesterol, what we call LDL, is known to be associated with like most heart problems. So their LDL number is something that has to be in control. Now, even for LDL, there is no one particular cutoff. Cutoff is actually different for different people depending on what their risk. So somebody's LDL is 125, it's normal for them, but that same 125 is actually not considered normal for another person.
Okay.
So it really comes down to what other risk factors they have and that family history if they have or not. So again, cholesterol checking, EKG, those are some of the simplest basic tests. On top of that, we have a whole slew of testing. If your risk is perceived even a little bit higher, nowadays you can check if somebody is already blockage formation or not. So how do we do that? Stress testing. If you have any symptoms, any chest pain, shortness of breath, any tightness which is unusual, then getting a stress test is very essential, because sitting resting, it's very difficult to pick up heart problems. Putting somebody on treadmill in front of a cardiologist or a doctor and looking at what happens, it's a much better way of detecting what we call ischemic heart disease or blockage formation. Oftentimes people have risk factors, but they don't have any symptoms. Then what do we do? And that's where I think things like coronary calcium scale, which is a CAT scan, simple CAT scan takes 10 minutes. It can tell you if there is calcium deposition, which is like early signs of blockage formation in the heart or not. Takes, as I said, 10 to 15 minutes. Most hospitals, most radiology centers do this. They charge like less than $100 for this. Another test is what we call carotid intima media thickness, which shows that one of the first arteries in the body where blockage can start forming is arteries that feed the brain. And on the ultrasound, you can see if these arteries walls are getting thicker or not. Again, another 15-minute test, not invasive. We just put a little gel and look on ultrasound. We can do this testing in the office in 10 minutes or less.
Really?
That can tell people, yeah, it's phenomenal. And the third test, if you have risk factor, I would say is HSCRP. It's a blood test that tells us that if you already have markers of inflammation in your blood vessels, because one of the major reasons why these bad things like heart attack and stroke can happen is because your blood vessels have inflammation inside. And this is a simple blood work that can tell you right away whether that inflammation is there or not. So again, how do you pick up and how do you find out? It depends on an individual. No risk factors, at least get an EKG and cholesterol and make sure you don't have an end blood pressure check and diabetes check. If you have risk factors and you have symptoms, then you gotta go at least get a stress test. If you have risk factors but you don't have any symptoms, then you can do the CAT scan, the carotid ultrasound, the intima media, and the blood work for HSCRP. These are the very well proven with robust data supporting.
Is that stuff done automatically, or like when you reach a certain age, or is that stuff you have to really push for usually?
It requires a consultation with the physician right now. There are certain places where they do this screening test and then you can just go and get it done. If you have insurance, most insurances pay for this stuff. If you don't have insurance or the right insurance, even then, like there's a lot of places you can just pay a little bit out of pocket and get this stuff done. So these are pretty simply ordered and done tests. When you say you have to push for it, you mean like push? It's just knowing about it and paying attention to it. It's about early screening. You want to just be aware.
I'm when I go in for my yearly physical at 50 next year, is my internist going to say, hey, it's time to do your heart checkup and let's.
Well, I hope your internist is listening to this webcast, right? No,
um,
but it's true. Unfortunately, there are certain internists, there are certain primary care doctors who are phenomenal, and they pay attention to this cardiovascular, screening and mortality and morbidity. And there are some that are still not paying that much attention as much as they should, or they're not doing early screening. And this is why it becomes tricky, right? Because at the end of the day, I mean, everybody in your phone book should get this test. So some internists, so this requires a lot of education. So as a cardiologist, I feel like my role is not just to train community and people who are listening to this, but also some of this gatekeeping physicians, who truly could make a big difference. And I think with there is American College of Cardiology, American Heart Association, American Lipid Association, some of the big nationwide organizations are doing a great job in raising awareness amongst physicians as well as amongst community and patients as well. So it's being done way more frequently, way more often than what it used to be. Is 100% of the people who should be getting this done are getting them done, not unless you have symptoms.
well, I know what I'm pushing for when I go in February. Thank you.
Yeah, no, absolutely.
Message received. What role does, when and you went through this when you started the Apex Center and with all your other ventures, what role does stress play and what, I've always wondered kind of how stress, what that does to the body. Like I know what it does physically sometimes, and I know what it does and how you react. And I know the outward signs of it, but what is it doing to your body?
Yeah, so stress is tricky, right? Stress is a very generalized term. Medically speaking, what is stress? Stress can be something as simple as you're just aggravated, or stress could also be underlying like depression and anxiety. And oftentimes people say they're stressed, but in reality, they may have already developed pathological level of generalized anxiety or depression in early signs. So it's very tricky. It's very it requires careful attention to know before somebody is stuck into that rabbit hole. Stress causes tremendous impact on the body, right? Stress causes release of this catecholamine hormones in the body, which raises the blood pressure. So stress is number one reason why people get hypertension, apart from their genetics, obviously, and poor diet. Stress causes, impact on people's heart rate. So there is a factor that we follow, what we call heart rate variability. If somebody has a smartwatch, it actually measures now. Apple Watch does it, the Whoop Pen does it. There you go. Oura Ring, which is pretty cool, which can actually do this heart rate variability. What heart rate variability tells is actually the impact of stress, right? So how does it work? Heart is a muscle, right? Heart is a pump. It pumps blood to the rest of the body. Just like any other muscle in the body, it's controlled by the brain. And the nerves control the heart. The nerves that control the heart are called sympathetic and parasympathetic nervous system. The job of one set of nerve is to raise the heart rate and blood pressure. That's your typical flight or fright response. Something happens and then and this is when your heart rate goes up, blood pressure goes up, and all that stuff. The other set of system is the parasympathetic nervous system, which is your vagal tone that keeps everything into check, keeps the heart rate under control. This is where people who are very athletic, their heart rates run very low because they have excellent vagal tone. Their parasympathetic nervous system is very strong. People who are in constant flight or fright mode, constant fear, stress, anxiety, they have constant trigger of the sympathetic nervous system all the time. So if you look at their heart rate variability, it really drops because heart is just always in this mode. So it cannot even function. It cannot go from 0 to 60 very quickly. And this leads to this heart rate variability, which is truly now is a marker of the stress people are going through and catecholamine surge in the body people are going through, is demonstrated to show not only like hypertension, but like heart attack, congestive heart failure, irregular heart rhythms like atrial fibrillation, and other arrhythmias, and which eventually leads to stroke. So stress, up until now, we sort of knew is bad for you physically speaking, apart from mentally speaking. But now we have like documented objective evidence and proof that it's truly bad, for people's health, especially the cardiovascular health. Um, and on top of that, stress also plays a role in improper diet. Stress also plays a role in improper exercise. Stress plays a role in worsening, smoking and, drinking and some of those addictions. Stress, a lot of people who are, a lot of stress and there are a gazillion jobs to do and they're under ADHD. These are the folks who are doing Adderall. These are the folks who are doing excess caffeine. All those things are in turn can raise blood pressure and heart rate again.
Mm-hmm.
So stress is like one of those meta factors which plays like role in like 5 different ways. Sorry.
Yeah, you mentioned Adderall. I was reading something the other day about that, and I have the worst case of ADHD and ADD in the world probably, and I couldn't even conceive of like taking Adderall. I mean, I'd probably be Superman if I did, but it just scares the daylights out of me, like to take something like that.
But ADD is also one of those most over-diagnosed entities, they say, and not all ADD is that bad actually. They used to say that ADD is like horrible. I mean, a lot of like successful CEOs have ADD, and they actually attribute that success to ADD. They say, hey, like the reason I'm successful is because I can wear multiple different hats. I don't know what it does to their stress level. I mean, they're probably used to being in this fight or flight. So this is where I think it becomes tricky that, and we have a whole generation now coming. I mean, you thought like, I think we are part of the same generation, right? So if you look at the generation that's coming out, Jesus, like they are in constant fight or flight because we didn't talk about dopamine, but dopamine is the other,
I mean, these things here, man, this is,
yeah. So it causes this constant secretion and release of dopamine in the body with every trigger that comes out. So that could potentially, so we're gonna see a slew of cardiovascular issues. I'm getting prepared for a tsunami of heart problems that's gonna come our way.
What are some ways you can really work on your stress level? I know we talked about diet and we talked about exercise, and those are all important, but there've got to be some other ways to sort of, I'm a fan of meditation as a way for me to sort of decompress and let my brain sort of slow down and focus. And I mean, are there some things that you can recommend for people? I mean, aside from the diet and
No, but I think meditation is great. I mean, it definitely, we know that practicing meditation, practicing, that decompression, what you said, and mindfulness, really, meditation along with mindfulness, paying attention to like physical sensations, emotional state, paying attention to that, like refocusing on the values, refocusing on gratitude. Gratitude is actually known to relieve stress, like again and again proven. And now the interesting thing is with all these biomarkers, with these fitness apps that we have, fitness watches we have, and other wearable devices, we can look at all these biomarkers: resting heart rate, vagal tone, heart rate variability. All those things can tell us, these are all surrogate markers of like your overall physical health. And it's actually now first time, because of these things, we have objective evidence that how meditation, mindfulness, paying attention to spirituality, expressing gratitude, focusing and sort of centering yourself, all these things, in addition to proper diet and exercise and all that, it actually truly leads to improvement in these biomarkers. And we are hoping that we're going to get what we call the hard evidence, which is like people who are doing meditation at like less likelihood of getting heart attack and stroke and stuff like that. So yeah, I think meditation is one of the great things that you mentioned. I think it plays a huge role. I'm actually a big fan of meditation myself. Expressing gratitude, sleep. We don't pay enough attention to sleep, but sleep and stress are very correlated. There are studies now saying that people, when they work more than 45 hours a week, the risk of heart problems start climbing up. When they go above 55, it actually goes like this. it doesn't go linear. It's not a linear
It's
curve.
like,
It's logarithmic curve. So it's like from 45 to 55, it really starts climbing. By 65, if you work more than 65, your risk of heart problems like really, really shoots up. So you're
well, that's why
talking to somebody who works more than 65 hours a week. I think a lot of probably your viewers are working that many hours a week. And it is something of concern. And what happens, unfortunately, it happens at the expense of sleep. Same way, sleep studies are showing that lack of sleep and lack of sound sleep, it's not just the sleep, right? It's also the quality of the sleep. Sleep itself is a whole another conversation, but lack of quality of sleep, again, is directly correlated to, to this heart rate variability and stuff and autonomic dysfunction, which in turn can lead to, like higher stress and all this other stuff. So proper sleep hygiene is important, proper meditation, gratitude, all those things can truly reduce stress.
Okay, I totally agree. I think that if you look at all of that as sort of a whole wellness program for yourself, I think you can really lead a much healthier life. Do you believe in work-life balance, or is it? I
think it's more about a value balance, honestly, rather than a work-life balance, because I think life is more about work. I mean, like when we say work-life balance, we kind of put work in one category and we put everything else in the other category. And I think there are more than two categories. I think there are multiple domains. There is health, physical health, spiritual health, your relationships, your social goals, and, in your financial goals, and then your, work ambitions. So there's a lot of different domains. And I think at the end of the day, everything comes down to having the proper balance. And knowing your values, like for balance is different for you versus for me. Everybody's a different balance, but knowing what your balance is, knowing what's your ideal state, ideal distribution, and trying to focus on each aspect is I think essential in this.
Yeah, I like that distribution. I look at it as I don't look at it as such as a work-life balance as much as I look at it as more of an integration. You've got to integrate all these things, and it's just like you do with your schedule at home or anything else, or your work schedule.
It's so much easier said than done, right?
Absolutely. Absolutely. But I think if you don't look at it as a separation, you look at it more as an integration, then I think you can be more successful at realizing that sometimes work is going to, you're going to work that 65-hour week one week, but one week maybe you take off and you go to your kid's soccer game, or you make the time, you fit those things into your, and you, like you said, I think you have to make priorities on that distribution. Yeah, no doubt.
Yeah.
What, I want to talk about staying calm under pressure. How do you do it? Like, how do you, we've all worked for people. I work for people who I worked for this one boss one time that when I was really one of my first jobs, and I mean, he blew a gasket every time something went wrong, and, would have a fit. And, I've worked for people who are calm under pressure and calm under fire. And are there ways you can learn to sort of manage that fear and
and
action?
It's something for us. It's very, very essential to learn, right? So imagine when I'm doing my procedures and surgeries, I am holding like tiny wires inside people's heart arteries, and this tiny wire, a micromillimeter movement in a wrong direction can cause perforation, and a person can literally like collapse and die. And and these procedures can be tedious. They can be 3 to 4 hours on your feet nonstop. So there's a lot of need, like for yourself as well as for the others, if you want to make a living out of working on people's delicate arteries in the heart. So that calmness of mind is something that you have to train yourself. It comes with practice. The meditation and gratitude and all those things actually play a role into that as well. There is a very famous book called Into the Magic Shop. It's actually one of my favorite books. It's by this very well-renowned neurosurgeon, Jim Doherty, and I'm probably screwing up his last name. Jim Doherty or something like that. And it's Doherty, D-O-T-T-Y, Doherty. So Jim Doherty was actually one of the very famous surgeons. He still is. Now he's more like an entrepreneur and innovator. And he has a beautiful life. Into the Magic Shop is his biography, and he actually talks about this. So he learned the mantra of meditation at a very young age. And the book starts with this great, like, case example where he's working in somebody's skull, and there is, he exposed the brain. There's an artery there, and there is nonstop chaos because it's a little kid. Anesthesia doctors there, nurses are there, and there's so much like chaos and all these things going on. And within this moment, he cuts like the wrong artery, and his entire operating field is just within a split second is just filled with blood. And now his heart is pounding. He's like sweating. He's nervous, and he's like he lost all his confidence in that second, and like the blood gushing. And this is something I know because I've sort of been there, done that. Because when the blood starts perfusing, so it really requires going back to the core. You have to, and this is what he did. That he found a way to remind himself of the day when he was into this magic shop, where he went to the magic shop as a child and learned the ultimate magic, which actually was meditation and gratitude and centering yourself. And he practiced that over years and years and years and years. And he mastered this art up to a point that it would take him all of 1.5 seconds to center himself, bring that calmness, be mindful, be right there in the moment, and immediately, and he clips the artery, like he sealed the artery and saved the kid. It was just one of the examples of a lifespan for 30, 40 years. And I actually feel myself same way. Sometimes I have a young person like, comes in with really catastrophic like cardiac arrest. I mean, like 2 weeks ago, I was on call and I had this guy who had 14 like shocks to his chest, and like comes in young, he's not even in his 40s, and we have to do this surgery, and it's really, there's a lot of chatter that goes in the brain with this, because you're worried about him, his family, you're worried about your own, like, if you're gonna be able to save this guy or not, how the staff is reacting, how the team is reacting in the operating room. There's a lot of factors that come into play. Unless you have practiced and figured out a way to calm yourself and have something to sort of reflect back and go to the core that you believe in, it's very difficult. So I think, and people's stresses come different way. Like my stress comes in this way. I'm sure somebody who works in business or finance, they have their own level of stress. And it's not like just because it's not a life or death situation, it's any less degree of stress. Everybody finds themselves in middle of the storm every now and then. And when you are in the middle of the storm, like you gotta find a mechanism, and that mechanism, you cannot find it in the storm. This is something that you practice on a quiet, peaceful day and train yourself. So I think it again goes down to the same thing, knowing your values, knowing your belief system, practicing your mind to work on them, calming yourself, meditation, be mindful, and look at the bigger picture. I mean, the minute you stop thinking, like the ego doesn't come in that, rather than saying like, how do I do this better, like what can I do, is like, what can I do to make the world better, my end user better, like whoever, how can I think from the other person's standpoint, and practicing your mind with those things, I think can help with bringing the calmness. Obviously, as a cardiologist, I can say take a beta blocker or take anxiety pills or Xanax, but I'm sure there are other things, that can work better.
Yeah, it's just like taking that moment before you react to breathe, right? Breathe, center, get, and not let that.
Between every stimulus and response lies your opportunity to choose your response.
Yeah, that's right. Well, this has been a lot of fun, and I do thank you so much for that insight and how we as entrepreneurs can stay healthier, and some of the things that you recommend and do, and I think that's it's been helpful to me. So I know it's going to be helpful to a lot of people out there, and love to have you back. I'd love to have a panel discussion on some of these topics in the next couple of months, and I'd love to have you back on the program to join the panel.
Absolutely, thank you so much, and it's been a pleasure. I think it's a very relevant, very important topic. We used to believe that engineers and doctors were at risk of heart problems, and healthcare professionals in general. And then we thought about cops and firemen. If there is one group of people right now who is the highest risk, is the solo soldiers, as I like to call them, the solopreneurs, the entrepreneurs, because they're fighting there, they're fighting wars, single-minded, keeping that
That's
smile,
right.
keeping all that stress inside, there is a little bit stigma of exposing your health problems. There is this go, go, go mentality. So, I think we are all gotta like look out for each other, and it's okay. And then I think it's time that we talk about this and bring it up forward and make a difference. So again, thank you so much for this opportunity. Great time chatting with you, and we'll love to come back in any capacity.
Well, thank you. Thank you. I do appreciate it. And again, very valuable, very, very valuable. Thank you guys for spending some time with us on your lunch hour and on the West Coast. I know it's in the morning, so early morning there, and lunchtime or so on the East Coast. So thank you so much for your time.
By the way, if they have any questions, they can reach out, any cardiovascular question. We'll be very happy to answer, on our website, or, reach out to me on LinkedIn. I think my bio is going to be down there as well. Yep. Or you can just reach out on apexheartandvascular.com.
And we'll put the Apex number or website on the link.
Perfect.
And so that people can reach out directly. And yeah, please do reach out on LinkedIn or any of the other platforms, and we'll certainly try to answer those questions. And maybe what we could do is one day just have actually a question and answer show where people can throw their questions at you, and we can do that at some point. That'd be a lot of fun, I think. And again, thank you. You can find out the schedule of upcoming shows. We've got some really fantastic shows. I'm going to be doing a show live from New York on the 16th of December at the MG 100 event that we're going to have in New York. I've got Benjamin Jaffe, who we're going to talk about how to get venture funding, how to best position your company for venture funding. I've got Joel Kalm on in a couple of weeks to talk about cryptocurrency. I've got Oleg Konvalov to talk about his new book, Leaderology, which is a fantastic read. And so please go to the website, powerlunch.live, to check out our upcoming schedule next week and in the upcoming weeks. And thank you so much for your time. We'll see you tomorrow.